in the meantime, but I will move on to our final speaker, if that's all right, who is Dr. Soumya Chattopadhyay, who is a Senior Research Fellow in the Equity and Social Policy Programme at Overseas Development Institute, and was previously in the Poverty and Equity Global Practice at the World Bank. His expertise is in quantitative approaches, to identifying groups that remain persistently marginalised from development processes. And his current research areas include assessing policies, programmes, and their impact on such groups through sustainable development goals and other development initiatives. His presentation will focus on exploring the mechanisms which make those less privileged, such as ethnic and religious minorities, rural agrarian workers, those working in informal sectors, and those in poorer socioeconomic communities, more vulnerable to the pandemic and its response systems, and how learning from this can potentially be applied to help reduce rather than exacerbate existing disparities. And he's going to take us into a more international global focus. So really looking forward to Soumya's presentation here. Pass over to you now.
Thank you. I'm just sharing my screen. I assume it's visible.
Yes, we can see it now, yeah.
Okay. Good afternoon, everyone, and thank you for inviting me. And it's a fascinating discussion so far. My presentation, as Lauren just mentioned, is slightly different from the perspective that we've followed up until now, which is more UK-centric. My presentation, our analysis, as we are sort of internationally sort of oriented, is much more about what's happening in the world outside, where the direct linkages to BAME might not translate direct one-on-one, but every country has its own group of vulnerable, marginalized populations and segments that who we actually study more in depth, and sort of look at the influence of events and how that actually reflects on development practice, policies, initiatives that are taken, and then what has been the sort of impact of this sort of pandemic shock, which took everyone by surprise, is a sort of an ongoing and sort of in its infancy, I would say, in terms of the depth of analysis that we have done, as well as the world has been doing. So this is kind of a reflection of where we are, what do we know right now, with definite caveats that we know very little in terms of systematic evidence. And for that, primarily the reason is that most of our data, which comes from household surveys, typically are done on 3, 4, 5-year cycles. And we're looking at historic data, not mapped up to what has happened in the last 6 months. It's going to be a while before we actually can piece together a cohesive story across countries and between countries over time. Nonetheless, we can say some things where we can mimic or proxy for the BAME classification through poverty and those who are typically poor or marginalized. And that's what I'm trying to sort of look at, as well as others have too, whether that's in the World Bank and other think tanks like us. We're looking across age, gender, socioeconomic status, whether you're the head of the household or you're someone elderly, retired, which type of work do you do and which sector you are employed in? Is it rural or is it urban? And do you have some special needs that actually get exacerbated due to COVID, the nature of the sort of pandemic itself and the recovery process? So let's start with the initial impressions. When we saw these sort of highlights in the news, initially, I distinctly remember this is February and March of this year, we thought, well, COVID seems like a great leveler. I mean, if royalty to sort of heads of governments to royalty in Hollywood can get it just as much as anyone else, well, there might not be much difference. Everyone is at risk. Well, everyone is at risk, but in the sort of subsequent months, we have seen that the reality is a lot more nuanced, in the sense that how that risk plays out in terms of infection, recovery, both in terms of health as well as in terms of the economics, does vary a lot between countries and within countries. And this is just a snapshot as recent as 2 days ago, from looking at what is just the incidence of cumulative affected people. And given the fact that some of the darker red regions, which is where you had most cumulative numbers, are also the ones where you initially, I mean, this is Europe, US, India, and now Brazil. Well, the more affluent the country is, the more sort of travel you have, and that actually is one of those conduits through which the pandemic actually transferred across borders very fast. So while this kind of shows sub-Saharan Africa and parts of Latin America not so deep red, that's because they may have actually not hit the peak yet, because the less affluent, the less mobile the people, and hence your ability to sort of stay insulated, extended for a longer period of time. And so it's just a matter of time before they actually also, we expect, will show up as deep red colors. So far so that we have 17 million cases as of this morning, and this is Johns Hopkins doing the best it can from collecting data across the world. More than 660,000 people dead across 188 countries. So this is no longer an equalizing case. This is, I mean, the spread is global. In fact, the ones which are less affluent countries and people who are less affluent within those countries are bearing the increasingly bearing the brunt of the disease. Now, it's been actually called a disease of poverty, and this is Dr. David Nabarro, who's a special envoy to the WHO Director General on COVID. And there's a kind of a cyclical process, a vicious cycle or a nexus between poverty and vulnerability that is one feeding into the other, and in turn being fed by the impact of it. So this is a cycle, and breaking this cycle is going to be tough. And we've actually seen the sort of challenges sort of show up. But on the other hand, there is potential if we can actually work our way through in a thoughtful manner in terms of both policy and practice. But right now we are still in the phase where we are kind of stuck in a low-level equilibrium or a vicious cycle where we seem to be unable to break this cycle. Sometimes it's abated, I mean, but then the second wave comes in, or then it actually comes back in. And in the case of the most vulnerable people, it seems like it is a very sticky proposition. They're finding it even harder to break out because they are in that cycle where poverty is sort of entrenched in that sort of in that loop. So just as a way of looking at the poverty dimensions of COVID, the World Bank expects that about 70 to 100 million people would enter back into extreme poverty in 2020, just this 1 year, 70 to 100 million people. And this is extreme poverty, which means that they're living in less than $1.90 a day. And another 176 million people would move into poverty in the middle income countries, which are better placed than most of the low income countries in terms of dealing with poverty or having incidents of poverty. We've also noticed that inequality has actually increased, and that actually puts another added burden on increasing the number of people in extreme poverty. I mean, just as we've also seen, and I think The Economist came up with the estimate that the richest 8 people in US during the COVID pandemic had increased their net worth by 26%. So you have increase in poverty. At the same time, you have also increase in inequality, and they kind of sort of latch on to each other even more. It seems that because that there is a global recession on the horizon, I mean, it's already here and it's going to be a longer lasting recession, the scope for actually moving out of poverty is also diminished. And so the World Bank and IMF have revised their estimates of what they expect to see in terms of growth prospects downward almost every 2 months for the last 6 months. Here's the projection, and you can basically see how sharp has the increase in extreme poverty been just in the span of 1 year to 2 years, so much so that even the April projection looked much better than what it is right now in the June projections. And we have, from a downward trend, suddenly shot up, and we have sort of lost the gains in decreasing extreme poverty to what we were somewhere around 2016. So we basically lost 3 years of progress at a time, at a period when we were making good progress. There weren't other economic shocks to speak about. There was this concerted world effort in terms of reducing poverty through the Sustainable Development Goals of the SDGs. So all the stars, in other words, were aligned, and yet one shock and we have lost the gains we've made over the last 3 years, 3 or even 4 years. So this is a big shock in economic terms, and it's not going to go away. It's a structural change. It's going to take a while before we can sort of undo this and get back on the same trajectory as before, let alone it'll take a longer time to get back to the levels that we were before. So what we're going to look at is, as I showed you, that there's a sort of cyclical cycle. So there are these channels of impact. So we'll look at the channels of impact, both the health impacts and the economic impacts, as the means to what actually holds the cycle together, which we are finding hard to break out from. Now, what are the health channels which causes this, poor people to actually get stuck or be more exposed to the pandemic and make it harder for them to get out? One of them is the fact that it's just the nature of the work that they do. Most of them are essential workers, so they can't really work from home. They have to go to place of work. And we've seen this in UK, but it's even more prevalent in other countries, where they are the cleaners, they are the suppliers, and so on and so forth. So they themselves are exposed more and more, and there's no alternative rather than to actually do that work. They also have poor health conditions to start with because they're poor. For instance, just as an example, stunting rates, this is a percentage of children below the age of 5 who are reportedly stunted. Well, in the high income countries, it's about 2.8%. Countries like Bangladesh and India, we are in the 30% ranges. So that gives you and just an illustration of how much deficit we have in terms of health conditions, health status, which lead to the comorbidities. And that's contributing partly to why the health effects are higher for the poor people. We've also have good evidence that some of the remedial measures that are being professed, which are like safe distancing or sanitation, washing your hands with water and soap, well, they're not that feasible if you don't have running water, or you don't have access to soap, or it's too expensive. Only about 26% in Bangladesh, actually in rural Bangladesh, have access to running water with soap. Compare that with near 100% in OECD countries or developed countries. So it's kind of a compounding effect made worse by the fact that most of the developing countries do not have well-funded healthcare systems that are not only there on paper, but are also reliable and accessible and affordable. There are some developed countries too, high-income countries too, which suffer from the same problem, which, one of the examples is US in itself, that it's not universal. To make things worse, health coverage, health insurance is linked to jobs. So when the job goes, well, you don't have health coverage. So it's a kind of a conundrum. That's really hard to break out from. Now, looking from the economic channels, well, you could have a loss of job from sickness, or you might be the caregiver of someone else who is unwell at home. So you have to sort of take time off from jobs. But also, as some of the other speakers have also said, that you have had the experience of loss of earnings because you have to shut down your enterprise or your business, or your place of work has had to shut down or furlough. Given the fact that nearly 80 to 90% of some of these developing countries have workers employed in the informal sector, which already have low wages, they also rely to a fairly high level on remittances from abroad, which are also drying up. So you actually have a perfect storm in some ways, that you don't have the capacity to earn the amount of money that you were getting initially. You don't even have the capacity to look for other alternative sources of income. So poverty gets even more entrenched. Very few countries also have good, robust social protection system. I mean, for instance, over here, or in the case of US, you have a social security system and a scheme by which each individual person is identified, and there could be a check mailed out, whether it's $600 a month or something less, something more. But if you are an informal worker working in the agricultural sector, seasonally employed, or you're a migrant worker, you don't really exist in a sort of universal database that can be a harness to transfer money to you, even if the government has money. Now, it's a very different question that the governments themselves are stretched for cash. They are financially and fiscally stretched so that they can't actually afford to do some of those. Some countries are doing sort of fairly good, robust work in overcoming these challenges. And I take the example of Pakistan, which has transferred money to rural poor through a system of mobile phone transactions, so that even if the person doesn't have a bank account or other forms of formal ways of getting money, a system has been devised that some support, some relief can be meted out to them. In the case of India, this was done through actually transfer of food rations. So it's in kind rather than in cash. But they have those limitations. I mean, you still have to have a phone number. You still have to be, I mean, the system has to be reliable enough that the intended recipient actually does get what is actually given out to them. So it's kind of a perfect storm, both in terms of added hardship from the health channels, but also added hardships from the economic channels, which makes this vicious cycle, I mean, even more vicious now than, say, let's say pre-COVID times. And we don't see a natural way in which it can be broken just by sort of wishing it would go away. So coming to the point that's, I mean, this is perhaps the sort of last part of what I would want to say here is, given what we know, what are our concerns? Well, we've seen that countries are releasing or easing restrictions. And as countries do that, there's also been an increased incidence of or reemergence of COVID in pockets, in cases. So while the lockdowns were sort of draconian in some cases, I take the example of India, where it led to thousands of people sort of trying to migrate back from cities and slums to their native place because they didn't have any jobs, they didn't have food, they didn't have shelter, and people lost lives in coming back to a semblance of protection of their native place. So lockdowns were harsh. It was a crude measure, but at that point in time, when flattening the curve, so to say, was of primary sort of importance, it did serve a purpose. But now that those restrictions, those public health restrictions are getting eased, the incidence of cases have gone up. How do governments, how do policymakers, how do sort of individuals, households and individuals now respond to the fact that there is an inherent element of risk involved? So how do they internalize those risks? In the meantime, there has also been very significant and fundamental changes in the labor market. we were moving towards, I mean, some formalization, increase in formal jobs, but also the whole notion of the gig economy, where you were working part-time or you were working from home, you were sort of, I mean, renting out your services, your specialized services. Well, if you are in a connected world, if you are in some kinds of jobs, it might be that your job rebounds back fairly quickly. But it might not be so for the temporary workers, the migrant workers who move from rural locations to urban locations in search for just some form of employment. At the same time, the scope or the ability for governments to keep funding social protection schemes is under severe stress, because most governments have actually utilized their fiscal surplus, if they had any to start with, but also have borrowed heavily against future projected earnings to meet with the current crisis. So their ability to keep giving social protection is again severely hampered, and is going to be so even more once, let's say, it hits a point where you can't borrow anymore, which is, you could have, I mean, a recession I mean, so far we haven't had the inflation, but there is a possibility that you could have a stagnation as well as an inflation, the stagflation, which is even harder to get out of. I mean, countries have taken decades to get out of stagflation. In terms of health benefits, well, there's been a lot of emphasis, rightly, on the pursuit for vaccination, or the pursuit for developing a vaccine which is robust enough. We don't have it yet. In fact, all estimates seem to suggest that it won't be ready this year. We don't even know the nature of the epidemiological nature of the pandemic, that would some vaccines work, or is it going to be a seasonal pattern? We haven't even decided how to distribute these vaccines across populations. So there you have another scope for perpetuating inequities, where we have seen some countries or companies being sort of already earmarked for their first stock of 100,000 vaccines are going to country X or country Y. They have sort of front-loaded the funding with the promise that they would get the first shot of vaccines coming out. So there are equity issues there, there's social justice issues there that need to be addressed. How do we actually get around that? We've had disruptions in education, training, and the link towards job market. We don't know whether education as we knew it is going to get revived, when, how, and how long is going to be this gap between the disruption and the sort of restart. What does that mean in terms of future employment opportunities? That's again another question that sort of hasn't been addressed or hasn't been looked at yet in much detail, but we will have to grapple with this. And finally, I would say that we do need data-driven policy interventions at a time when, as we've all sort of labored on this point, that this pandemic has sort of shown that we need disaggregated data perhaps more than ever before. But the ironic turn of events is that the nature of the pandemic is such that you can't actually go around asking for data at a level of disaggregation because of public health restrictions. So at a time when you need the data is also the time when you have the most challenges to getting such data. You also could well imagine that governments are trying hard to get a sort of remedy to the pandemic itself through finding a virus, rolling it out. Investing in data systems might not be something of their priority in a situation where their finances are already stretched. And good, reliable data systems take time to actually develop. So it's nice and dandy to say that we will target our responses to where it's needed the most. It's not going to be one size fits all solution that's going to be rolled out. but then on the basis of what information, and if that information set is either outdated or not fit for purpose, then you're back to the system where, or back to the state where you basically say, okay, this is the best that we could do, which may not actually give you the tailored, nuanced interventions that possibly could break that cycle between poverty as well as their health outcomes. So while there are sort of opportunities, it is, I mean, we have to develop those opportunities and sort of grab hold of those opportunities to transform this sort of crisis that we are in into something which is much more sustainable. And when I say sustainable, not just to deal with COVID as we know it now, but COVID as it might be come next 6 months or the next such crisis, because as we've basically seen, the frequency of such pandemics, either localized or, localized as endemics or globalized, has actually grown in the last 20 years. So this is not the end story. We don't even know what the end story of COVID-19 might be, whether COVID-20 is about to come with a very different shape, size, and sort of impact. We don't know yet. So we have to build systems that sustain our approach to deal with it in a way that is robust enough to deal with these nuances. And we haven't actually gotten around to developing a cohesive strategy yet. What we have seen from the World Bank, from the WHO, different governments and their funding arms, is more of an ad hoc approach, but not a sustained, systematic, cohesive, collaborative approach. That's our kind of worry for what might actually happen in the months and perhaps years ahead. But let's see where we end up. So at our institute, the ODI, we've been kind of looking at different aspects of COVID-19 in terms of its implication for healthcare systems, to education systems. And so I've just listed out a few of these sort of in these bullet points here, in case anyone's interested in following up on the sort of research and analysis that's going on at our institute, but as well as across the world, given the sort of scarcity and paucity of data that we are sort of hampered with. Thank you.
Great, thank you, Soumya. That's really, really interesting, and really great to have those links and the opportunity to follow up with you. So hopefully people will take you up on that, because it'd be great to have partnerships and collaborations developing out of these sessions. So we've got a couple of questions coming through. So we've got about 10 minutes left of our webinar. So obviously any questions for Soumya, do send through to the Q&A, but also if you do have any final questions for any of the other speakers, start sending them in and we'll get through as many as we can in the time we've got left. We've got a question for you, Soumya, on from Gillian Ashmore, are there any new ideas emerging around how to reach those who are not identifiable within current formal systems? And she said that can be for all speakers, but it came through during yours as well. So if you've got any thoughts on that, or if anyone else wants to come in on that.
I'll take one stab at it. We haven't had new ways of sort of identifying them, because identifying who's kind of what we say left behind. In fact, for those who are familiar with the Sustainable Development Goals, the SDGs, there are 17 goals, but one underlying theme across all 17 is this whole notion of leave no one behind commitment that all countries have signed up to. And that's kind of the sort of underbelly of across all the 17 goals and different targets. So there have been sort of ongoing efforts since the start of 2016, when the SDGs took over or started, to look at these disaggregated pockets. Now, we have a fairly good understanding of what typically constitutes and who typically are these marginalized communities: the elderly, women, children, and people living in rural areas with low education, with low, therefore also low income and wealth, those employed in agrarian activities, or have sort of part-time non-formal jobs. So it also includes ethnic minorities or religious minorities. So we kind of have a fairly robust idea across countries, consistent with across countries, of who they are. What we do not have a robust idea right now is what impact has COVID had on each individual sort of criteria, but also, as other presenters have said before this, the compounding effect of multiple strands or multiple themes. So that would definitely take some time. We have the tools, we have the techniques. I mean, household surveys, we moved from face-to-face surveys into phone-based surveys. We need to actually undertake them to carry it out. I will mention that it has become a slightly political too. I mean, the whole notion of gathering data, I mean, while we do need it for active policymaking, we've also seen evidence where countries have been hesitant to let data come out because for the fear that it might reflect poorly on the health interventions that they're doing. I mean, in some cases, health officials or health ministries have said, we'll allow you to do the economic analysis of how COVID has impacted on businesses and households, but please do not ask questions on health service delivery. In the case of US, recently, I mean, the Trump administration has said that all data on COVID has to now get routed through the White House rather than the CDC, the Center for Disease Control, which was much, I mean, the latter being much more sort of independent and verifiable, whereas when it comes through a political arm of the government, it has the potential for getting manipulated. So we do know how to get it. We need to renew focus and funding for systems which can actually do that. And we also need some time, but time is something that's kind of running out.
Great, thank you. Did any of the other panelists want